Hi, everyone. Thanks for joining. We'll get started in just a couple of minutes in case there are some folks who are a little bit late. All righty, we will go ahead and get started. So welcome everyone. My name is Megan King and I am a public health education and communication specialist at the Washington Poison Center. Really excited to talk to you all today about medication management. This is one of my favorite presentations to give because I feel like it has a lot of very useful, actionable information in it. So I hope this will be helpful for you all. Quick note before I get started, you'll see that Seattle Parks and Rec, their logo is here on the bottom of the slide. They have been a great partner so far. I've been working with their lifelong recreation program to schedule a series of presentations for folks. And lifelong recreation works with people who are ages 15 up to provide a bunch of different social and community engagement activities. So thanks to them again for helping host this webinar. So I so miss being able to present in person to people, but alas, we are in a very virtual world right now. So you'll have to just make do with pictures of myself. I also have a picture of my colleague Alex on here, and Alex is helping out on some of the back end with some of the tech with this webinar because we just got a new platform. So you might need to bear with us a little bit if we run into any snags, but so he will also be there and he can help answer any questions, moderate, stuff like that. So before we dive into medication management, a couple of housekeeping items. We're gonna have you all stay muted right now, just because it's a lot easier to make sure we get all questions answered and cover all of the material that way. So if you have any questions, please go ahead and just pop them into the chat box. So you'll see that on your attendee control panel. It should be down there at the bottom. Ask away. You can either send it to the entire audience, you can send it to just Alex or I, whatever you would like. Then you'll also see there is a materials section in your control panel. So that is where I have posted the slides that you can download, and then I'm going to talk about a couple of different resources today. So I've included PDFs of those resources there for you as well. So you're welcome to download them and use them as you wish. We are recording this webinar today, and once it is through, I will post it on YouTube, and I will send out the link to all of you. All right, so here is our agenda for today. I'm going to start with just a brief overview of the Washington Poison Center, and then we are going to dive into medication management. So we'll cover medication errors, adverse reactions and accidents, and we'll round out the presentation with a quick section on what to expect when you call us at the Poison Center. So we will go ahead and get started. And remember, please just ask any questions in the chat box. So the Washington Poison Center has been here in Washington helping people, providing treatment advice, providing information about different poisons for over 60 years. So what do I mean by poisons? We take a very, very broad definition. For us, anything can be a poison. Anything can be poisonous if it's used the wrong way, by the wrong person, or in the wrong amount. So that applies obviously to a lot of different substances. We have what you would traditionally think of as a poison, so bleach, chemicals, but then also considered for us as a poison are flowers, plants, berries, medications, alcohol, drugs, fumes, vapors, snake bites, insect bites and stings, household products. Really, the list goes on and on. So what people are probably most familiar with is our Poison Center telephone helpline, which I'll go over in the next slide. But we also provide a lot of education to folks in Washington and really throughout the country as well. So we provide clinical education to nurses, pharmacists, doctors, med students, public health students. And then we also provide public health education to the general public, to teachers, to anyone who is interested in learning about poison prevention and harm reduction. So our telephone helpline, this is the phone number for it. It is a national toll-free telephone number. So every poison center in the United States uses this phone number. You can call us anywhere, and you will be routed to whatever your local poison center is. This number is completely free and it is 100% confidential. We are open 24/7 every day of the year, so you can call us at 2 a.m. or 2 p.m. and someone will be there ready to help you. If English is not your preferred language, we also have access to interpretation in over 260 languages. So when you call our Poison Helpline, you are going to speak with one of our expert staff members who are called Specialists in Poison Information, or SPIEs. It's a really fun acronym. So SPIEs are all nurses, pharmacists, and poison information providers who have gone through a ton of special training in poisons and toxicology. Many of our SPIEs have been working in our call center for a long time. So our SPIEs actually average around 13 years of experience in our call center. If they ever need any additional assistance, we also have on-call board-certified medical toxicologists who are available around the clock. So these folks are NDs who have specialized in toxicology. There are only 7 in the state of Washington, and they all work in some capacity for us. So I have some of our data up on this slide just to show you the volume of calls that we handle each year. So this is from last year, 2019. We managed over 125,000 calls regarding more than 66,000 cases. So you'll see there's a difference in number there because cases oftentimes involve multiple calls because we will follow up with you a lot of the time. If it's we'll check in on you, see how you're doing, offer you some more treatment advice. Or if we're speaking with a healthcare facility, oftentimes those cases will involve multiple calls. So who are we getting calls about? Unsurprisingly, about half of our calls are about kids younger than 6. Really, if you've been around kids at all, you know that they explore the world with their mouths, so they really get into stuff that they shouldn't get into. So it's pretty unsurprising that a lot of our calls are about kids. But we are not just for kids. We receive a lot of calls about teens, adults, and older adults. And what's important to know here is that a lot of times those calls tend to be more serious than our pediatric exposures. Calls to us come from lots of different places, oftentimes from people at home, from people at work or at school. But we also receive calls from medics or EMTs, any of those first responders who are calling either on the scene of an accident or when they're en route to a healthcare facility. And then about 20% of our calls or so are actually from healthcare providers themselves in emergency departments or other facilities who are needing some extra advice and consultation on poisonings. So I shared with you how broad our definition of a poison is. So we obviously receive a lot of different calls about a lot of different things. So our spies, they categorize all of these calls into different buckets, which are up here on the slide. So we have unintentional poisonings, we have adverse reactions, we have intentional exposures to potentially poisonous substances, excuse me. But we're obviously here today to talk about medication management. So we are going to focus on the most common call categories that are relevant to medication use, which would be these three: medication errors, accidents with non-pharmaceutical substances, and adverse drug reactions. And we're going to go through all of those now, starting with medication errors. And I'll just give a quick definition of what I mean by medication errors. So for us, we say a medication error is any of these 5 wrongs. So the wrong dose would mean someone has taken their medication twice, or they took 3 pills when they were only supposed to take 2. The wrong medicine would be someone accidentally took an old prescription, or they mixed up which medications they were supposed to take. The wrong person means someone took a different person's medication, so like their spouse's medication or even their pet's medication. The wrong time, someone took their medications too close together. And the wrong way, someone accidentally swallowed a medication that was supposed to be put on their skin. So regardless of age, medication errors are a big issue that we encounter at the Poison Center. Unfortunately, we don't have our 2019 data yet, but the call volume was pretty similar in 2018. So for that year, 13% of our cases were about medication errors. That's for all ages. Of those cases, about 17% were in kids younger than 6. But over a quarter were in adults 60 and up. So older adults really account for one of the main age groups within the medication error cases that we receive. And why is that? I mean, medication errors are a fact of life. It's really easy to make them, and they can happen at any age. But older adults can be particularly prone or susceptible to medication errors for a couple of different reasons. So first is that, well, we're going to hear more about them because older adults are more susceptible to consequences from errors. So they might be more likely to have side effects or adverse reactions from any error that's made, which would definitely result in them calling us. But also, there are more older adults in the world. If you've seen the news lately, or really for the last 2 years, I'm sure you've seen that baby boomers are aging and the older adult demographic is just exponentially increasing in size. And so because of that, and alongside of the population growth is increased use of medications as medications become more effective. We're seeing a lot more older adults who are taking a lot more medications, which means an increased likelihood of more medication errors. Older adults can also encounter some age-related challenges. I mean, it's natural for our bodies to change as we age, and some of those can really cause challenges in successfully or safely taking medications, like cognitive decline, physical limitations like worsening vision, or even grip strength and opening bottles. So there are a lot of reasons why older adults might be more prone than others. So I'm going to have Alex launch a poll for you all. I want you to guess what you think the most common medication errors are for older adults. So go ahead and launch that poll, Alex. And you can select more than one answer. So just what do you think are the most common? Give folks a few more seconds to do this. All right, Alex, you can go ahead and close the poll. You want to share the results? Yes, all right. So it's a tie between wrong dose and wrong medicine, and then wrong time was the other one you all selected. So you are so close. Alex, you can go ahead and hide those results. So the top 3 medication errors that we hear about in older adults are wrong dose, wrong medicine, and wrong person. All right, so it can be really easy to make medication errors. So we're going to go through some different scenarios to show you different examples of how they can happen. So our first scenario is with Charles. Charles keeps his pills in the pill bottles and packages he receives from the pharmacy. After making breakfast, he gets out his medications for his morning dose, and he takes a couple of his pills, but then the phone rings. He gets up to answer it. He talks to his daughter for 15 minutes or so, and then he returns to his medications. But he can't remember if he had taken all of them or just some of them, so he takes them again to make sure. Unfortunately, this means that he has accidentally taken a double dose of some of his medications. So, what do you all think is the first thing Charles should do? I'll have you go ahead and type that in the chat box on what is the first thing Charles should do. So go ahead, type in the chat box, what do you think he should do first after realizing he's taken a double dose? Awesome. So we have call the 800 number or doctor. So yeah, so call the poison center or his doctor. We have get a pill box. Yeah, these are great. So those are both definitely on the right track, especially the first one. So calling the poison center should be the first thing to do because we are here to help and we are always open. A doctor's office might not necessarily be open 24/7, so you are guaranteed to be able to talk to someone when you call us. You can also call us if you're unsure what has happened. So call us before you take your meds again or before you decide to skip them because we can tell you what would be safest to do. So Samantha, who said get a pill box, was definitely on the right track with prevention strategies because there are some very, very easy things to do to avoid having a double dose or wrong dose situation. So the first of which is to create some sort of physical system to know when you have taken your medication. So one great thing to do is to have a medication calendar. And there are lots of different ways that, lots of different shapes and forms that medication calendars can take. So we have one on the left-hand side that I also uploaded into the material section, which is a basic medication calendar checklist where you would write the medication down and then check it off once you've taken it. If a paper checklist form like that isn't the best option for you, you can always use a traditional calendar. So either a paper calendar that you keep on the wall or even the calendar in your phone. There are also a lot of cell phone apps that can help with remembering to take medications. So the image I have up here is actually the MediSafe medication management app. It's free and it works really well in helping track and remind folks when they've taken their medications, and you can check it off once you have taken it so you know for sure that you are done with your doses for that time. And then, like was mentioned in the chat box earlier, using a pill organizer or a pill box. So just like medication calendars, this can take a lot of different forms. So you can request bubble packaging from your pharmacy. Some pharmacies can actually package their medications together for you. So they would take all of the different doses for Monday morning, for example, and they would put them all together in one little blister or bubble for you to take. Or you can do it yourself and have your own pill organizer where you fill it. So there is an example like this one on the slide, which is a pretty extensive if you were to take multiple doses per day. But there are also just very simple pill organizers you can use. The pill organizer on the far right is probably one of the more complex ones. It's called the MediSet, and it actually uses flashing lights and audio cues to help remind people to take their medications, and will even provide an option to notify caregivers if a medication hasn't been taken. So there are lots of different levels of support that you can get with pill organizers, really ranging from a simple box to something more like the MediSet. So wrong dose can be more than just accidentally taking your pills twice or mixing up how many pills you were supposed to take. It is also very easy to accidentally double up on medications with the same active ingredients. And we see this particularly with over-the-counter medications. So that's why if you are going to take any over-the-counter meds, or really if you are taking any prescription medications, it's very important to follow the directions closely. Take the recommended dosage at the recommended time increments. And when you're taking over-the-counter medications that you wouldn't typically take, make sure you're reading those ingredients closely to make sure you aren't double dosing with any other medications you're taking. So acetaminophen is a common culprit in this. So acetaminophen is Tylenol, but it's also in a lot of other common medications like cold and flu preparations. So, if you're taking Tylenol for a headache and then you also have a cold and you take some Dayquil, then you would be double dosing on that acetaminophen. All right, so we are on to our next scenario, which is about Cynthia. So a few months ago, Cynthia's doctor decided to change a couple of her medications. Cynthia immediately switched to the new meds, but she never got rid of the old prescriptions in her medicine cabinet. So now it is time for Cynthia to take her evening dose, and she's talking to her partner as she grabs her medication bottles, and she accidentally grabs one of her old prescriptions out of habit. She was on that medication for years after all, so it's really easy for her to just grab it out of habit. She keeps chatting and takes her pills, not realizing that she made a mistake. It's only when she's putting the pills away that she notices it was the wrong prescription. So one more time in the chat box, what do you think the first thing Cynthia should do? Call the line. Yep, perfect. You all are going to get sick of this number probably because you're going to see it a lot, but hopefully that means you'll remember it. So Cynthia should call the Poison Center immediately and tell them what happened. So taking an old prescription can be risky and concerning because it can interact with some of the other medications that you're taking, or it could produce effects that are different or stronger from what you need. So a key strategy in making sure that you don't take the wrong medication is getting rid of any leftover, unwanted, or expired medications. So people, a lot of times, they'll keep these medications because they don't know how to get rid of it. But it's really important to dispose of unneeded medications because, I mean, like in Cynthia's case, it can prevent accidentally taking the wrong medication, and it can also prevent medications from accidentally or even intentionally getting into the wrong hands. So you might have heard of a couple of different ways to get rid of medications. So like I've heard flushing them down the toilet, mixing them with coffee grounds or kitty litter, crushing up pills, throwing them in the trash. All of these methods, though, can be dangerous for both you, but also for people, pets, and the environment. So the best and safest way to get rid of medications is to take them to a medication drop box. So we run takebackyourmeds.org, which is a website that shows all of the different free, secure medicine return locations in Washington. So it has a map function, like I have the image here on the slide, but then it also has just a search function by city or by zip code. So you can take a look at that to find what's closest to you. These secure medicine return locations, they accept most prescription and over-the-counter medications, but sometimes there are restrictions, and that will be specified. And you can check the Take Back Your Meds website to look at what those restrictions are, because it will state that when you click on the medication drop box or return location. Obviously, COVID-19 complicates take back a little bit because we don't want folks to be making unnecessary trips. So our recommendation right now is to take back those meds if you're already going to be there. If you're already planning on going to the pharmacy for something and there is a drop box there, just go ahead. But otherwise, don't make any unnecessary or unneeded trips. Just safely store medications at home. So you can definitely store them up and away, out of sight and out of reach of any kids or other people that might be coming into the home. And then if possible, lock them up. There in King County, there is another option. Some folks can qualify for disposal by mail. So you can go to this website, medproject.org, and request a mailback envelope. So an important thing to know with this, though, is that not all substances are accepted. So they won't take any vitamins or supplements, any illicit drugs, and some other things. And if you need to return inhalers or injectors, it's a separate mailback service. It's still on medproject.org, but you would need to differentiate between the two when you make a request for an envelope. This is available in some counties outside of King County as well, but it is definitely not statewide. So just go to that website, type in your zip code, and it'll let you know what's available there. So using a medication list is another important way to make sure that you take the right medications. So medication list needs to include all prescriptions, over-the-counter medications, vitamins, supplements, and any other substances that you regularly take. At a minimum, the list needs to include each medication's name, dose, the time you take it, and any special instructions for taking it. And then you need to be sure to take that list to every healthcare appointment, just to make sure that what you are taking is accurate, to make sure that there isn't any potential for interactions with your medications, and just to make sure that your healthcare provider is as up to date as possible on your medication plan. So if you don't have a medication list already, I uploaded in the material section of this presentation a medication list development guide that will walk you through all of the information to capture and then also medication list templates. Like you can see an example on this slide of the template or worksheet. So our medication list is a little bit different because we have folks use one worksheet per medication instead of just having it together all on one page. We do this because then it's really easy to just remove a worksheet when that specific medication's information is no longer accurate. That way you don't have to redo your entire list. So there are separate worksheets for prescription and over-the-counter medications or supplements because there's really different information that's required for each of them. It's also very important to make sure that you understand what you are taking and understand all of the different instructions and information that is important about the medication. So to help people with that, again, this is uploaded in the materials section. We created a little worksheet called 10 medication questions to ask a provider or pharmacist. So it gives the exact questions you can ask your provider when they are going to put you on a new medication, or you can take it to the pharmacy and ask the pharmacist when you're getting your medication. So we're on to our third scenario, which is about Jackie. So Jackie and her husband share a bathroom and keep their medications in the same cabinet. Jackie is getting ready for bed and it's time to take her evening medications. She reaches into the cabinet and grabs a bottle, but after she's taken a couple of pills, she realizes that she took her husband's medication. So I want you to put in the chat box, why do you think this could be dangerous for Jackie? Why could a wrong person error be dangerous? It could interact with something else she's taking. Yep, perfect. So yeah, so this can be a dangerous error because just like what was said, it can interact with another medication she's taking, or it could even interact with a condition that she has. So for example, if she already has low blood pressure and accidentally took a medication that lowers her blood pressure even further, yeah, that can be dangerous. Oh, and it's in the chat box again. It could raise or lower her vitals and be dangerous. Perfect. So this phone number again, which hopefully you all know by heart now, Jackie, you should call us immediately and tell us what happened. To prevent this from happening in the first place, though, there are some easy tips. So first, always keep your medications in containers. So if you leave loose medication out, it can be really difficult to tell whose is whose. So this, I feel like this sounds obvious, but it's pretty common. So I like to tell the story of my own grandmother who would, in order to remember to take her pills in the morning, she would put them in a candy bowl on the kitchen counter. But she would also have that candy bowl of pills next to actual candy bowls. And it was very confusing and could definitely have resulted in someone accidentally taking a medication. Other prevention tips, so store your medications separate from those of other household members and pets. So it can be good to keep them in completely separate locations, but that's not always possible. So you can store them in separate pill organizers and use some different identification methods to differentiate between people. So I have on this slide, there are these bands that you can put on pill bottles, so each person would have a different color. They don't have to be fancy like the ones on the slide. You could even use just colored rubber bands. You can also use different colored pill boxes, or really any other kind of labeling, pieces of tape, coloring the caps with a marker, lots of different ways. And know that wrong person can apply to more than just you. So when you take medications, other people can accidentally or intentionally get into them. So we have some extra safety tips to keep meds out of the hands of others. So first, keep medications out of reach and out of sight. This is especially important if you ever have any kiddos around the house. And then lock up high alert medications. So we define high alert medications as opioids, cannabis, sedatives, and antidepressants. For these medications, the consequences of accidentally taking them can be pretty concerning. So it can really be risky for someone's health if another household member were to inadvertently take one of these. There can also be an issue with intentional use by others with these high alert meds. I'm going to talk specifically about opioids for this slide. So, I mean, I know you all know about the opioid crisis that's going on, and we are definitely experiencing it here in Washington too. We share one stat with folks that 2 Washingtonians die from opioid abuse every day. So this connects back to medication safety, because 3 out of 4 people who misuse opioids start by using medications that weren't prescribed for them. So those are usually medications taken from a friend or family member. So that's why it's very important, if you're taking any of these high alert medications, to keep them out of sight, out of reach, and locked up. There are lots of different kinds of lock boxes, and they're really available all over the place. You can get them at drugstores, you can order them from Amazon, lots of different things, ways you can order them. All right, so I'm gonna have Alex launch another poll just to see how many of you are grandparents or ever have any kids that visit your home. Give a few more seconds for folks. All right, Alex, go ahead and close it. And you can share it out. So it's split right down the middle. But you can go ahead and hide that now, Alex. So we have some specific tips for anyone who's a grandparent or anyone who has kiddos that might come around their home. So the first is, which is to not take medication in front of children. So kids, they like to mimic the adults in their lives. And so, you know, when they see you taking a medication, they might want to pretend to be like you and do that as well, and they might end up taking a medication. And then keep medications out of sight and out of reach. You've heard this multiple times already. Kids explore the world with their mouths, so be sure to keep anything that might be toxic or harmful out of sight and out of reach of them in child-resistant containers. We also tell folks to check their carpet or floors periodically for any dropped medication. So this slide shows medications and candy and how similar they can look. So if one of these were to be on the ground, it is really difficult for kids. I mean, it's difficult for adults to tell what might be candy versus what might be a medication. All right, so we're on to adverse reactions. So let me check the chat box really quick. I don't think there have been any questions. Okay. So adverse reactions from drugs can be a couple of different things. They can be unintended side effects from a medication and also side effects from drug interactions. So just like we did with medication errors, we have a scenario here with Rose. And in this scenario, we're going to emphasize alternative and complementary medicines or supplements. just because there are so many different kinds that can interact with other medications that people take or interact with their bodies in potentially harmful ways. But adverse drug reactions can definitely happen with prescribed and over-the-counter medications as well. All right, so here's the scenario. Rose has diabetes, and she hears that ginseng can help lower her blood sugar levels. She starts taking a ginseng supplement, which then starts interacting with her insulin. It makes it hard for her to regulate her blood sugar levels, and her doctor becomes concerned that her insulin dose is incorrect. So, not knowing that she's taking ginseng, he ends up adjusting her dose. So, Rose's doctor ends up actually adjusting her prescription. So that's why it is so important to talk to your doctor or pharmacist before you start taking a supplement or other kind of medication, just because it can definitely interact with the condition you have and can affect the other medications you take. You can also call the Poison Center to ask for information about any potential adverse reactions or drug reactions that you may have with a specific substance. So ginseng is just one supplement that can result in adverse drug reactions. This list is just a smidgen of the different supplements and their potential interactions or side effects. So if you are interested in taking a vitamin supplement or introducing a new over-the-counter medication or really anything, make sure that you talk to your doctor or pharmacist beforehand and use that medication list. Take it with you to your appointment, to the pharmacy. Make sure you have everything on there. I added this slide in about self-medicating during COVID-19 because that's been a really big concern for all poison centers across the US during the last few months. There are just so many rumors that are circulating about ways to treat or ways to prevent COVID. There are also clinicians and researchers that are studying different substances or hospitals that are using different medications. So there can just be a lot of rumors of things that will work to help treat or prevent. But we want you all to know that there are currently no approved medications, vaccines, supplements, vitamins, or any other substance to treat or prevent COVID. So be very wary of any product that claims to do so, because using that product could have harmful or even life-threatening side effects. It can interact with any other medications you're taking. It can be quite risky. So before trying something, before altering your current medication plan, before really making any changes, talk to your doctor about any health or safety considerations that are specific to your body and to your health and to your current medications. You can also call us. We're very happy to answer questions about this. And then that final bullet point is to never ingest disinfectants like bleach or non-pharmaceutical substances, because that can definitely be very risky for your body and for your health. So in this last part of the section on adverse reactions, I'm going to talk very briefly about substance use. This is a little tricky because it doesn't quite fit into the adverse reaction category, because there can be a couple of different ways that substance use causes issues with medications. So the first of which is interactions, which is very much an adverse reaction. You know, some substances can interact with other medications a person is taking. But then there's also intoxication. So intoxication itself isn't really an adverse reaction, but the symptoms of intoxication can make it difficult for someone to manage their meds successfully. So we'll go through some specific examples in the next few slides. There are so many different substances out there, but I'm only going to go into 3 today. If you have questions about other substances, please feel free to give us a call at the Poison Center, and we are happy to answer any questions. All right, so alcohol is the first one. So older adult bodies take longer to process alcohol, and this means that they can have longer lasting effects from alcohol, as well as increased chance for interactions with any medications they're taking. So by itself, alcohol can cause problems with concentration, memory, it can cause drowsiness, which can make it difficult for a person to remember to take their medications or to take them correctly. And then there can be interactions with medications as well, which results in more drowsiness, dizziness, again, problems with concentration and memory. Double dosing can be an issue as well because some medications contain alcohol. And then some interactions with meds can make those medications less effective or can even make the medication harmful to the body. For opiates and opioids, this slide has a lot going on it, but I basically just want you to understand a couple things. So first, the difference between opiates and opioids. So opiates are drugs that are derived from opium, which comes from the poppy plant. So that includes morphine and codeine, as well as heroin. Opioids, on the other hand, are either fully synthetic, so lab-made, or semi-synthetic. But regardless of whether or not the drugs are lab-made or from a plant, they all attach to the same receptors in the body and have similar risks. But one thing to know is that the more synthetic an opioid is, the more powerful it is and the longer it lasts. So a big concern with those synthetic opioids is that Narcan or naloxone, which is extremely effective for a lot of the drugs up on the slide, it tends not to be as effective for more synthetic opioids because they are just so powerful. So the concern with older adults, opioids, and medication management is adverse reactions. Opioids have a stronger impact on older adults because their bodies metabolize drugs more slowly as they age. And plus, because older adults typically take a bunch of other medications, there is more chance for drug interactions. So symptoms of opioid use or effects from interactions can include confusion, sedation, impaired vision, problems with attention, memory, all causes of mismanagement that we've covered in different points today. It is important for me here to say that some people need to be on opioids, and we can't forget that, but it's definitely important to be aware of the risks. All right, cannabis is our last substance that we're going to cover. So cannabis, also known as marijuana, is first and foremost a plant. So the cannabis plant contains a variety of what are called cannabinoids, which are chemicals. The two that you have probably heard of the most are THC and CBD. So the cannabis plant is used to produce different products, and those products can have different levels of cannabinoids in them or different ratios. So some products might just have CBD, so no THC in them. Some products have just THC, no CBD, and other products might have a combination of both in different levels. And the products themselves run the gamut. There are so many different types of cannabis products, from your traditional dried flower or bud that would be smoked or vaped, to concentrates, to tinctures, topicals, edibles, medications, so many different products, and I swear there are new ones that come out every day. So the risk with cannabis, or one of the risks, can be drug interactions. So those cannabinoids, THC and CBD, are both metabolized or processed by the liver. So when they're being processed by the liver, they can temporarily affect the liver's ability to process other drugs that use that same system. So this is an interaction. Those other drugs can build up in the body and have stronger or longer lasting effects, which, depending on the drug, can be harmful to someone. So I'm not going to go into the specific drugs that interact just because they can be very hard to predict. But just know that there can be increases in drowsiness with some drugs, increased risk of bleeding with others, effects on blood sugar and blood pressure. But because these interactions are so hard to predict, it's best to talk to a doctor or a pharmacist, or if they aren't sure, you can call the Poison Center. Alex and I talked to our call center staff, and they are very willing and definitely able to talk about potential interactions with folks. Another risk with cannabis use is medication management itself, because of the cognitive implications that can stem from use, or the effects of intoxication. So THC is the psychoactive chemical, or cannabinoid, and it can impair a person's attention, their cognition, and their short-term memory. Another interesting thing is that THC can also alter time estimation. So someone who is high or intoxicated essentially would have difficulty knowing how much time has passed. So what has only been 30 minutes might feel to them like it's been a couple of hours. So when they're taking medications, that could affect their ability to know when they are supposed to take their next dose, or if they have even taken their medications to begin with. Those cognitive implications can also make it hard to understand any medication instructions and how to take them safely or correctly. So for any substance use, talk to your healthcare provider and pharmacist about any risks. Use an organizational system like that med calendar or pill organizers, and include the substance on your medication list. All right, we're down to the last 10 minutes here, and we just have 2 quick little sections to go through. So our final medication management category is accidents. So this is different from medication errors because accidents are with non-pharmaceutical substances. And that's oftentimes due to lookalikes. So lookalikes are products that look very similar to each other. So we have examples of some that are commonly mixed up here on this slide. And then we have a scenario, which is about a lookalike. So this is our last scenario for today. So it's late at night and Jordan is in bed. It's allergy season and his eyes are itchy, so he gets up to put some eye drops in. He doesn't turn the lights on since he keeps the eye drops in a drawer that's close by, but he also keeps a lot of other small things in that same drawer. So when he's feeling around for his eye drops, he accidentally grabs a craft glue bottle instead. The container looks and feels very similar. He doesn't realize the error and he ends up putting glue in his eyes instead of eye drops. So this is a very, very common error that we have definitely heard about a lot at the Poison Center. What is the first thing someone should do? You all know this already. Call the Poison Center immediately and tell us what happened. But like medication errors, accidents are very preventable. Simple tips are to always turn on the lights and put your glasses on before using any type of personal product. Store medications separate from non-pharmaceutical substances, especially those that look alike. So keep them in different cupboards or at least on different shelves. And then you can also use labeling to really differentiate between them. I have Mr. Yuck here on the slide, which is our Poison Center guy that we use a lot, but that's not always accessible for people, especially during COVID. So you can use markers, tape, stickers, really anything that can visually differentiate between those lookalikes. Accidents are especially prevalent right now during COVID because people are using products a lot more and might be using products that they're not as familiar with as well if they've had a hard time with all of the shortages of different sanitizers and disinfectants. So some safety tips for cleaning and disinfecting during COVID. Be sure to never mix cleaning products together because that can create hazardous gases. Do not use cleaning products on food. If you go to the grocery store, Just wash your hands after you get back and after you put your food away. You can wash produce just with water. There's no need to use bleach or any other sort of chemicals on it. Always store any cleaners or chemicals in their original containers and keep those products up high and out of reach of kids. With all of us wearing masks these days, it's very important to just wash them with soap and hot water. Please don't spray or soak your masks in any sort of cleaner or disinfectant, because that can mean you then inhale fumes from that, or have your skin irritated on your face from where your mask is touching. So soap and hot water is a great way to just get those clean without the risk. All right, last little bit here, just a reminder that we are always here to help. Call us anytime for any error, any accident, any reaction, any of these wrongs. We are here to help. We especially want you to know now of our availability, because accidents and medication errors and all the things we've talked about today are definitely we're all more at risk for having these sorts of accidents right now during this pandemic. Errors and accidents can occur even in the best of times in an organized space. But COVID has really has really disrupted a lot of our lives. So we can be at greater risk for making sorts of errors. And I just have some examples for why. We are all probably having new daily routines now. We might not be going into work, or we might have different hours, or we might be doing other activities. And this really removes any memory cues that we might have had with taking medications or doing other things. Like if you always took your meds as you were grabbing your coffee on your way out the door, if you're not going to work anymore, you might not be as likely to remember. We are probably all a lot more stressed today or anxious these days, which can mean we have less focus. We might have distractions. So like if you're a grandparent, you might be helping with childcare if one of your grandkids has been home from school for a long time. So those distractions also mean we're less focused and put us at greater risk for making an error. We might have less access to support as well. I mean, a lot of us have been pretty isolated these days, and we might not have access to the same caregiver support or family support, friend support that we had previously, who might have helped us with taking medications and managing. And then, as I mentioned earlier, rumors and misinformation have been pretty prevalent. So who can call us? You can call us. A caregiver or family member can call us. Anyone can call us. It doesn't have to be about yourself. Anyone can call. Our phone number, one more time, our services have not changed during this pandemic. We're still open 24/7. So please give us a call. And quickly, what to expect when you call us. We're first going to ask you to just tell us what happened. We'll guide you through a series of questions like this, like what was taken, how long ago, how much was taken, how is the person feeling? If you don't know the answer to all of that, that's totally fine. We just want to gather as much as we can. And then we're going to tell you what to do. We'll either tell you that you can stay home and what you should watch for and what you should do if you stay home. And we just had the stat released last week or 2 weeks ago that so far in 2020, we have kept 92% of people at home who called us first. So that's pretty great if you don't want to go to the emergency room or go to your doctor's office. But sometimes you will need to go to the ER, and we will tell you that, and we'll also tell you if you can drive yourself or if you need to call an ambulance. And we can also call ahead to the emergency room to let them know you're coming and can suggest a treatment plan. Then we're oftentimes going to call you back just to make sure everything is going all right. So you can ask us more questions then, or call us back later with any concerns. So please, one more time, call us. You're not going to waste our time. If you're ever uncertain about something, please, we would prefer for you to just give us a call so we can make sure everyone stays safe. So on that note, I'm going to have Alex launch the very last poll. which is asking you how confident you are in knowing how to call us. Give people a couple more seconds. All right, Alex, you can go ahead and close it. And I don't think there's any need to share that. Okay, that works. All right. So that brings us to the end of the presentation, right on the dot at 2 o'clock. My contact information is up here, as well as Lifelong Recreation's website and Facebook page. I will stay on to answer any questions that people have. And we do have one more presentation coming up with Lifelong Recreation, which is similar in that it's about medication management, but it's targeted towards caregivers of older adults. So it's much more focused on helping a caregiver determine how much medication assistance is needed for an older adult, like what are their current practices, what might need to be improved, and then walking through some different improvement strategies. So I will hang out here to answer any questions. Before you go, Alex is going to launch a little demographics questionnaire. It's super short. We need it for some of our funding. So if you are willing, we'd greatly appreciate for you to fill it out. You can answer some of the questions, none of them at all of them, whatever you are most comfortable with. Thank you so much. It's very helpful. And please ask away any questions that you have. You can also feel free to email me with any questions you might have, and I can address them later on. All right, I'll put my contact information back up here for everyone. So please feel free to reach out. Otherwise, I think if there are no questions, then I'm going to end the presentation. And thank you to Alex for doing all of our back-end stuff, launching all the polls. All right, folks, I'm going to end the training now. Thank you all and have a great rest of your day.